So this is the time to discuss on cholera, bacillary dysentery. So one of the most common causes for your gastroenteritis. It is a cause for acute watery diarrhea. So no mucus, no blood, mostly the watery diarrhea, very large amounts, maybe more than 1 liter per hour, fecal mass plus, and it is caused by the Vibrio cholerae. Two serotypes, 01 and 0139. So these two are very popular subgroups in the Vibrio cholera to cause cholera. And in both the groups, you will have the classical and LTAR. Notable disease under the international health regulations. So origin in the Ganga Valley. So near North India. Devastating epidemics have occurred. I think more than 7 or 8 pandemics are there with the cholera. Way back in 1828 and then 1901, 1920, 40, etc. In association with the large religious festivals, Kumbh Melas, etc., pandemics have spread the worldwide. So not only in India, so almost entire Asia, Africa, Europe, these are very commonly involved areas for this cholera fevers, cholera. Seventh pandemic due to the LTAR biotype began in 1961, spread via the Middle East to become endemic in Africa. So don't think that cholera is a very old disease. So as a physician, so we should know something about the cholera, bacillary dysentery, tetanus, etc. Because these are all the physician diseases. LTAR more resistant than the classical Vibrio. It causes prolonged carriers in 5% of the infections. Serotype 0139, a new classical toxigenic strain. It was found first time in Bangladesh, 1992. It's a new pandemic. Spread of infection, fecal-oral route, by the stools or the vomit of the symptomatic patients or of the subclinical cases. So some of this cholera may be the subclinical also, but they act as a carriers. Most of the people are the infective or clinical cases. Survival for up to 2 weeks in the fresh water, 8 weeks in the salt water. Transmission through the infected drinking water, contaminated with the fecal matter, shellfish, food contaminated by the flies, hands of the carriers, chefs, etc. So here the 4 hygienes are very important: hand hygiene, food hygiene, water hygiene, and environmental hygiene. So these are very, very important to avoid these outbreaks of the cholera or other dysenteries. Here it is a toxin mediated. Fever is unusual in cholera. Unlike in your bacillary dysentery, etc. Here the fever is very uncommon. They presents with diarrhea. It's a watery diarrhea. And these some of the people will have the nausea and vomiting also. So more of the vomitings and then the diarrhea and abdominal cramps, but no fever. Toxin activates adrenaline cyclase in the intestinal epithelials of the small intestine. See, most of these, they are resistant to the gastric acidic media. So then they go to the duodenum and then the small intestines, and then they infect the mucosa of the small intestines, epithelial cells of the small intestines. So there is the hypersecretion of the water and the chloride ion, massive diarrhea up to 15 liters per day, almost 1 to 2 liters per day, per hour. So death results from the hypovolemia, hypovolemic shock, etc. So it's mostly the sudden in onset within few hours. Severe diarrhea without any pain or the colic or the fever. Here that is a very important point in cholera. Is it sudden in onset without abdominal pain, without colic pain or without fever. Succeeded by the vomitings. Typical rice water material. So it is called as the rice water diarrhea. Okay. Consisting of the clear fluid with the flex of the mucus. Intense dehydration with the muscular cramps. These muscular cramps because of the hypokalemia, hyponatremia, extreme weakness. So extreme weakness and muscular cramps, both hyponatremia and hypokalemia, and severe dehydration, sunken eyeballs, skin target lost, okay, or irritability, etc. Shock and oliguria. So some people they present with acute kidney injury because of this massive hypotension and dehydration. So mental clarity remains good in these individuals. See the skin target of the abdomen and the last sunken eyeballs, extreme dehydration. So death from acute circulatory failure and improvement rapid with the proper treatment. Even today, a lot of the people that die because of the cholera. Young age group, 10 years, 15 years, 20 years, etc. So if you understand the pathophysiology of the cholera, where the fluid balance is very, very important. So the only treatment here is the rehydration, rehydration, and rehydration. So death from the acute circulatory failure and rapid with the proper treatment, improvement is good. Cholera sicca and cholera gravis. Cholera gravis is very, very severe cholera, where the fluid loss is more than 15 liters per day. Here the sicca is very intense illness occurs, a loss of fluid into the dilated bowel. Here in the cholera sicca, the intestines are dilated. They may not have much diarrhea, but all the fluid is accumulated in the intestines. It is also very poor prognosis, gravity. So kills the patient before the typical GI symptoms appear. More dangerous in the children. So the first they infected with the cholera, and now this is a cholera sicca. So they don't present with the diarrhea, but there will be the abdominal distension, and all the intestines will be filled with the fluid, and then they have 1 or 2 loose motions, and then they die. So this is cholera sicca, very high mortality. Cholera diagnosis is mostly the clinical diagnosis, easy during an epidemic. Bacteriological diagnosis for confirmation. So I have to send the stool for culture of the Vibrio cholera. Stool dark field microscopy is a typical shooting star motility of the Vibrio cholera. Tactile swab or the stool cultures. Management, early intervention improves the prognosis. Clinical assessment of the dehydration. Maintenance of the circulation by replacement of the water and electrolytes. Here the ringer lactate. So they use a lot of the ringer lactate here. Antibiotics. A 3 days treatment with the tetracyclines. So big thanks to Ella Pragat Subbarao. He invented the tetracycline. 250 milligrams 6th hourly, or single dose of the doxycycline or ciprofloxacillin. So they are the important antibiotics we use in cholera. All reduce the duration of the exhalation of the Vibrio and the total volume of the fluid needed for the replacement. So before these antibiotics, rehydration, rehydration, rehydration. So that is very, very important in cholera management. ORS effective and safe for all, but the most severely dehydrated patients. Addition of resistant starch to ORS reduces the fecal fluid loss and shortens the duration of the diarrhea. By enhancing the sodium absorption in the colon due to short chain fatty acids produced in the colon from non-absorbed carbohydrates. RL is the best fluid for the intravenous replacement. So when the fellow is not having much vomitings, so you can advise ORS therapy. Or when the fellow is with a lot of vomitings and etc. So the ringer lactate is the choice of the fluid. Fluid requirement calculate every 8 hours from the urine volume. That's very, very important. You have to respect the urine output whenever you introduce a lot of the IV fluids. Otherwise, the people will die of acute pulmonary edema. Stool and vomit output, estimated insensible loss. These are very important before you order the IV fluid therapy. So total fluid requirements may exceed 50 liters over a period of 2 to 5 days. Cholera cart for accurate record of the stool volumes. See the carts there. So in Vizag, we used to have an ID ward just opposite to the TB ward. So these are all the cholera carts. So the strict personal hygiene is very, very important. Clean drinking water or boiled. Avoid the food contamination with the flies. Vaccination. Parenteral vaccination with the killed suspension of the Vibrio cholerae. Oral vaccines containing the Vibrio cholerae and beta subunit of the cholera toxin. In epidemics, public education is very important. Control of water resources is very important. Control of the population movement. Mass single dose vaccination. and mass treatment with tetracycline or doxycycline or cephalosporins. This is also very important. So main water and sanitation and hand hygiene. So these three are very, very important. Food handling is very important to avoid these outbreaks, to avoid the prevent. So essentials of the diagnosis: history of the travel in the endemic area or contact with the infected person, voluminous diarrhea, mostly the rice water, rapid development of marked dehydration, and positive stool culture and agglutination of vibrio with a specific sera. So that finishes our cholera.